Hello friends, this is Dr. Aman Upaganlawar, Associate Professor, Department of Pharmacology, SNJB's SSDJ College of Pharmacy, Sandwad, Nashik. Friends, today we are going to discuss about various animal models for peripheral neuropathy and its assessment. As you know, the International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of the damage. Neuropathic pain, as outlined here, is defined as pain arising as a direct consequences of a lesion or disease affecting the somatosensory system. Dear friends, if you see, the morbidity rate of neuropathic pain is estimated to be approximately 1% to 7% in developed countries, and several million people in Japan they are suffer from this pain. While neuropathic pain may occur due to various diseases and elements, the most common cause are peripheral neuropathy of varying origin, spinal cord disorders, multiple sclerosis, and stroke. These underlying diseases are often intractable, and the accompanying neuropathic pain also requires prolonged treatment. Patients with neuropathic pain usually do not respond well to a wide range of therapeutics and often have concomitant psychiatric symptoms such as depression, leading to a marked deterioration of the quality of patient's life. Now, if you see the introduction or a general aspect of this pain perception, you know pain is transmitted by two types of the affector sensory neurons, that is A delta and C fibers, from cutaneous receptor to the second order neurons at the dorsal horn of the spinal cord via first order neurons with cell bodies in the spinal cord dorsal root ganglia. Then it ascends the lateral spinothalamic tract to the thalamus, where the third order neurons are projected from the thalamus to the cerebral cortex, as shown in this figure. Two types of pain system, that is the lateral and medial system, send projection to the cerebral cortex. In the lateral system, neurons are projected to the somatosensory cortex. In the medial system, they are projected to the anterior cingulate cortex and insult cortex. The lateral system is involved in recording pain intensity and the site of transmission, whereas the medial system is involved in pain associated anxiety and fear. If you see the structure of the nerve fiber, here it consists of the motor nerve, sensory nerve, and the autonomic nerve. So motor nerve, it is a larger portion which is myelinated, and sensory nerve, it is myelinated, thinly myelinated and unmyelinated, whereas autonomic nerve, which is thinly myelinated and unmyelinated. So particularly when we are talking about the pain perception or neuropathic pain or peripheral pain, most of the 90% of the cases, the sensory type of the nerve or neurons, they are highly affected. What is neuropathy? Neuropathy is defined as the damage or dysfunction of one or more nerve that typically results in numbness, tingling, muscle weakness and pain in the affected area. Whereas peripheral neuropathy is defined as it is a derangement in structure and function of peripheral motor, sensory and autonomic neuron. There are several causes which produces peripheral neuropathy. Among that, diabetes and alcoholism. In the developing country or in the developed country, you can observe the diabetes mellitus and alcoholism. These are the most common cause, and 60% of neuropathy occurs because of this diabetes as well as alcoholism. Second primary cause worldwide for this neuropathic pain is the leprosy. And third, in addition to this, HIV infection that accounts for increase in the number. Apart from that, genetic origin, metabolic disorder, which also includes the diabetes, then infection or trauma, then inflammatory ischemia, and toxic or heterogenic insult. Now, peripheral neuropathy can be judged or can be estimated by having two hallmarks of this neuropathy. These are allodynia and hyperalgesia. What is allodynia? When pain caused by stimulus that does not elicit pain normally or non-noxious stimulus can produces the pain are called as the allodynia. For example, hair touch or cold or warm water or touch with the air can elicit the pain response. Whereas hyperglycemia, hyperalgesia, it is one can experience an enhanced sensitivity to pain is called as hyperalgesia. Now there are several models reported for the development or induction of the neuropathic pain. Here we will go in deep with some few models. Now the classification of this neuropathic pain models are as follow. Peripheral nerve injury model. Here these are the models. Out of this, chronic constriction injury is the widely used and standardized model. Second is spinal nerve ligation model. Then drug induced neuropathic models are there like vincristine, then your taxans, then another drug like your platinum. So these also produces neuropathic pain. Apart from that, some disease also produces neuropathic models like diabetes or persistent hyperglycemia can produces the neuropathic pain. So this is again a widely used model. Then central pain models are there. Then some miscellaneous neuropathic pain models are there. In that, alcohol consumption can also act one of the model. Now we will discuss about the chronic constriction injury model. Now this is a widely used surgical model described by the Bennett's and the G. Now in this case, what happen? You can anesthetize the animal, then remove the fur of the animal of the left thigh portion and give a small cut to the portion and just enter inside this. You can observe a femoral vein, and too near to the femoral vein you can observe a white color thread like a structure which is nothing but the sciatic nerve. So in this figure you observe that the sciatic nerves are ligated. By this way you can isolate or you can get these sciatic nerves. Now once you get the sciatic nerves, you can loosely tie the muscle, loosely tie the nerve with 4 ligature using 4 chromic gut, and the distance between each ligation is 1 mm. And after surgery you incision the sutures and you can keep the animal for recovery period. Now some silent feature of this model is that it develops peripheral mononeuropathy. Recovery period is 2 weeks, then testing 4 weeks, threshold score is less than 4.5 gram for allodynia. Pain develop in 14 days and after that you can test your drug. Decrease in nerve conduction velocity and greater damage to the myelinated axon has been observed. Valerian degeneration and dorsal root ganglion neuronal axon can be observed. Mechanical and thermal hyperalgesia and cold allodynia will give you the response. Apart from that, you can do the histopathology of the sciatic nerves, which will show you the structural changes in the Another most useful model is the spinal nerve ligature model. Now here this is suitable for the spontaneous pain, and these are assessed by mechanical and cold allodynia and thermal hyperalgesia. Here in that case you can expose the L5 and L4 lumbar region, and then the spinal nerve in that region you can give a tie. Don't tie the L4 lumbar region. If you tie this, it will produces the paralysis in the animal. But if you touch this nerve, it will shows the reflection in the animal. So it is recommended that you can tie the L5 muscle, and this technique was uh, described by Kim and Chung. Then the silent feature of this model is recovery 7 days, testing 3 days, and threshold value is given, that is less than 4.5 gram. It is a complete nerve injury, it is not a partial. Then commonly used peripheral mononeuropathy. Then mechanical allodynia you can get first day of the surgery. Hyperalgesia you can get third day of surgery, and cold allodynia, thermal hyperalgesia, and spontaneous pain after 1 to 2 days. So here you can observe the drastic reduction in the number of myelinated nerve fiber and causes Valerian degeneration. But to perform this, it requires a skillful surgical procedure. Then the next and widely used model is the streptozotocin induced neuropathic pain. Here what you have to do, you have to inject the streptozotocin 55 mg per kilogram subcutaneous to the animal, and after 72 hours you can withdraw the blood and check the level of glucose. If the blood glucose level is found to be more than 250 mg per deciliter, it is considered as hyperglycemia and the rat is considered as a diabetic rat. Now, this rat is continuously tested for 1 month, and every week you have to check it for the development of allodynia. But allodynia will be developed. For this development of allodynia, it is necessary that there should be a persistence hyperglycemia. So the point at which you can observe the development of neuropathic pain, at that time you can consider this animal as a neuropathic pain animal. Then you group the animal as per your protocol. Then assessment of neuropathic pain is also one of the important part. Here you can go with the behavioral observation. Under that you can keep the animal into the cage and you just observe the general phenomena or these behavioral changes, including abnormal posture, then tremors, then abnormal motor movement, then reactivity to the stimuli. Means if you stimuli something, it will show the reflexes. Then arousal, alertness, lacrimation, salivation, and piloerection. It is what related to the autonomic nervous system. Lack of grooming, vocalization, then excessive repetitive action, yeah, stereotypes action. Then emacination, it is nothing but the thinning of the animal or weakening of the animal. And self mutilation, it indicates that the animal will try to remove the injured part or always try to touch the injured part. Now second assessment are the motor function test. Here you can do walking track analysis where you can observe the functional peripheral status of the animal. In that case you can observe the hind limb paw placing as well as the stepping. If there is any change in the appearance of that pattern indicating the motor function problem. Then hind limb performance by examining footprint. This is another way of assessment. It is called as the footprint method, where you can measure the distance between the heel and the third toe in the rat, distance between first to fifth toe, and distance between second and fourth toe of the rat or mice. So based on the walking track analysis and hind limb performance analysis, scientist has given the SCI score, that is SFI score, that is if it is 0 then considered your animal is normal. If it is -100, consider that it is total impairment. Then Rotarod test, it is used for sensory motor coordination, where in that case keep the animal on the rotating rod until the animal get fell down. You measure the time, how much time it is required. Then another is the grip strength. On a horizontal bar you keep the animal, that is grip strength, and maintain the position into inclined plane. This is another. Then landing foot spla. What is landing foot spla? In this case mice is gently taken up by the neck and tail, raise 15 cm into the air and release. When mice are held in the air, they spontaneously spread out their hind legs. While falling, they tend to bring their feet closer together again with a view to landing safely on the ground. In this case, the distance between the hind leg at the time of ground contact can be correlated with the animal's reaction speed and therefore reflects the nerve conduction rate. Then another method which is very widely used and it gives a very important finding. This is the assessment of sensory perception. You can go with the one fray here. In this case, the one fray is there which having the hair, and this hair is the nylon fiber, and these hair are standardized with a specific force, and if you apply any type of the force, it will generate only the specific force for which the each filament is given. So in this case, you can keep the animal on such type of sieve, and by using the filament you apply the force. So typically the filaments are available with 0.008 gram force up to the 300 gram force. Now how this is called as up and down method, which is given by the Kaplan. So how it is calculated, I will tell you. Suppose on the paw, if you are putting your one fray, and if the animal lifted his paw, then you give the score, that is X, and if it is not lifted, then you give the O. So for example, suppose I have started with the force per gram of 2, and if the animal has not shown any response, I will write here as a O, and then I will go for higher force, and in higher force again it will not give any response, I will put it as a O, and again further I will go for the higher response, then it will show the response, I will put the X, and again if it shows the response at 6 gram, then you go lower side, then go with the 4 gram, again it will shows the response, again goes to the lower side, you will get the O. So a particular type of pattern you will obtain, O, O, X, X, O. This is called as the pattern. Now for this pattern there is a particular value which is again given by the Dixon in his table. So if you observe, so OOXXO, the value is 1.122. Putting this value into the equation, you will calculate 50% gram threshold. Then pinprick test is there. It is called as the mechanical or tactile hyperalgesia. Here also you can use safety pin and apply perpendicularly to the lateral part of the plantar surface of the hind paw. Care should be taken that if you increase more force, there is a chances of damage to the hind paw. So cutoff time for this is 10 seconds and exert a mean force of 10.5 gram. So end point, how you can detect the paw withdrawal is the end point, and this is the formula whereby you can calculate the percent maximal possible. Then another is the acetone test, which is called as the cold allodynia. In this case, you can put a drop of acetone on a cotton bud and apply it to the plantar surface of the hind paw and observe the paw withdrawal latency, and again you can calculate the maximum potential effect by putting the value into equation. Then all of you know that heat allodynia or heat hyperalgesia is one of the tests where you can use the 45 plus minus 0.5 degree centigrade temperature for allodynia, and 52 plus minus 0.5 degree centigrade is used for hyperalgesia, and the end point here in this case you can calculate as a paw withdrawal or jumping or paw licking characteristics, and again you put the value of reading into the previous formula, you can calculate the percent maximum potential effect. Then another method, that is Randall-Seleto test, or it is also called as the paw pressure test. This is an instrument which is called as Randall-Seleto. What happen in this instrument, it is provided with the plunger and it is what, a sensor. You can keep the paw of the animal here, and with the help of one pad you can apply this pressure of the plunger on the paw. The time at which the animal get pain, it will try to remove its leg, or it get disturbed. So at that time you stop taking, you stop applying the pressure, and you can measure the percent compression break digitally in this instrument. At that time you can stop and you can calculate all the reading in percent compression, that is called as the latent period, and the distance between stimulating and recording electrodes, and then you calculate the conduction velocity, that is meter per second. Then apart from these behavioral and parameters, we have to, nowadays some molecular targets are used to indicate the your peripheral neuropathy, and these molecular targets are, you can target the ion channels, antiepileptic drug you can use in this case. Then Schwann cell induced myelination, this is another target. Then mitochondria you can target, then heat shock protein you can target, amino acid tRNA synthesis, and GT pages. So these are the various molecular target. Apart from that, you can go with the histopathology of sciatic nerves, which will give you the anatomical changes in the sciatic nerves. Apart from that, you can also go with the antioxidant parameter or oxidative stress marker. Apart from that, if you want to further go for molecular level, you can use this RT-PCR and gel electrophoresis, and you can find out. So there are a number of things which you have to carry out during this peripheral nerve evaluation. But only important thing is that whatever method is performed, you can standardize first, and you can do the same process throughout your project. If today you have performed, tomorrow you don't give the to your friend to perform, because it will vary. So only one person can perform this whole test. So this is what all about the peripheral neuropathy, uh, and these are the factors. If you manage all these factors, then it will be possible to do a proper evaluation of the neuropathic pain. This factor directly or indirectly affecting your result, and if your results are affected, you cannot get the reproducible result, or which cannot be correlated with the clinical findings. So this is all about the peripheral neuropathy. Thanks for listening.